The next item of business is a statement by Hamza Yousaf on COVID-19, the Cabinet Secretary. The Cabinet Secretaries for Health and Sport, Transport, Infrastructure and Connectivity are available to take questions at the end of the statement. There will be no interventions or interruptions. And before I call you, Cabinet Secretary, I've got 29 people down to want questions, and we're running late. So message to you, please, is to make them crisp, and please, Ministers and Cabinet Secretaries, succinct answers if we're going to try to get through them all before nightfall. A call on the Cabinet Secretary, Hamza Yousaf.
Well, in that vein, Presiding Officer, at the request of the Parliamentary Bureau, I'm here obviously with the Cabinet Secretary for Health and the Cabinet Secretary for Transport, Infrastructure and Connectivity to answer questions that members may have in relation to COVID. Our understanding is that members wish to ask questions in relation to care homes, prisoners on remand and in relation to Edinburgh Airport, but of course we will undoubtedly answer questions on a wider range of issues than that. So my colleagues and I are happy to answer questions on these matters and others, and I'm happy to leave it at that and take questions.
It's very kind, Cabinet Secretary. You didn't take up all your time. Now, I'm going to try to see if we can get as many as possible. The help of members who wish to ask a question were to press the request to speak buttons now, and also at the same time to indicate which Cabinet Secretary they're aiming their question at. The first question will come from Miles Briggs. Mr Briggs, please. Mr Briggs hasn't got microphone. Oh, this is a great start when you're running out of time. God. Can you, I know you're not supposed to, but can you try the other one? Yeah, just try that. I'll come back to you, Mr Briggs. Can I come back to you and we'll get that sorted? I'm sorry about that. I'm going to call Monica Lennon then, please, first, and I'll come back to Miles Briggs.
Yep, it's working. Thank you, Presiding Officer. My question is for the Cabinet Secretary for Health and Sport. Does she agree that we need more transparency in care homes? At the weekend, there were disturbing reports of a postcode lottery of COVID-19 deaths in Scotland's care homes, and we're still relying on FOIs and other journalistic investigations to get this information. So can I ask, what action is the Cabinet Secretary taking in response to these disturbing revelations to look at, in particular, the reasons behind the high number of deaths and infections in some care homes and fewer in others? What targeted support is she providing to these care homes? And further to the First Minister's commitment to me to consider further transparency measures, will the Scottish Government commit today to publish data on individual care homes in terms of the number of deaths, the number of infections and safe staffing levels, particularly now that we're starting to open up for visits to these care homes?
Cabinet Secretary. I'm sorry. There is. I don't know what's happening with recording, but the microphones are not going on continuously. Sorry, Cabinet Secretary.
So can you not hear me?
Oh,
good.
And no, it wasn't at the beginning.
Even without the microphone, my mother said I had a voice that could sell coal, so I think we'll be fine. As Ms Lennon knows, I am committed to transparency. We do publish a great deal of information, and in advance of it being publicly available, it is possible for me to let you know today that there has been developed with our care home sector, with our clinicians, our geriatricians, and with NES, any education body for Scotland, what is called a safety huddle tool, which will be a dashboard that will provide detailed information on the basis that individual care homes will upload information to it, so it makes matters much simpler for them. Rather than filling in many different returns, they will upload that electronically. That will let us see, and them and the Care Inspectorate, how they are doing in terms of the number of cases they have, the staff rota and the resilience of that rota that exists, and we will add to it as we progress through the pandemic other information, for example, around falls or nutrition or so on. It will replicate in many ways the successful dashboard information that we see across our NHS, particularly in our acute care home, our acute sector. That will also provide additional information in terms of resilience and assurance to residents, potential residents, and to their families. The final point I would make, and Ms Lennon is aware of this, in terms of the particular report about the difference in numbers of cases and, sadly, the numbers of deaths between different care homes in different parts of the country, we are working with Public Health Scotland, but we also want to use our clinical university-based advisors to assist us on this, to identify what the correlation is between some of that data and data on wider population health in those particular areas, and also to look at the timeline in all those care homes about how they started out in the pandemic, what support they got from us, what care inspector involvement there was, where they are on the current weekly testing programme, and so on. There is much more to this, and I'd be very happy to give Ms Lennon a very more detailed answer in writing.
Thank you, Miles Briggs. We're followed by Gillian Martin. It is, yes, isn't yet. There it is.
There we go. During the coronavirus public health emergency, the drug deaths crisis in Scotland is not being given the priority that it urgently needs. Across Scotland, we are seeing cuts to drug and alcohol services at the very time that they should be protected, and there's an increasing need to support vulnerable individuals. Can I ask if ministers will agree to intervene today to prevent any cuts to drug services in this financial year? And given the concerns of drug deaths, the drug death crisis has caused across Scotland during this crisis, the COVID crisis, will ministers also agree to urgent cross-party talks on this issue?
Cabinet Secretary.
So I believe that my colleague Mr Fitzpatrick has already indicated in a previous session that he's very happy to have cross-party talks on these matters. The Drugs Death Task Force recently reported, and I'm very happy to ensure that we write directly to Mr Briggs with the details of the work that it has undertaken to date, particularly in respect to the current pandemic and what its forward plans are. And then I'm sure Mr Fitzpatrick would happily have that discussion with him.
Thank you. Gillian Martin will be followed by Brian Whittle.
Presiding Officer, how can we reopen bars and restaurants in Aberdeen City again without addressing the following issues? Last week, MSPs were told by NHS Grampian that some bars in Aberdeen did not have correct or comprehensive contact details of their patrons for track and trace system. And we saw photographs of crowds outside certain venues where patrons could just turn up without booking ahead. When the Aberdeen lockdown is eased, what can compel all venues to have a robust and safe system in place, and how can it be enforced? I'm not sure who should answer that.
I think it's a Cabinet Secretary for Health's job. I think it is, isn't it? Yes, it is.
Is happening here.
Can I say the reason the microphone has to be on is for recording for the official report?
Okay, right, we're good. So the concerns that Ms Martin raises are serious concerns and concerns that we share. It is undoubtedly the case that across the hospitality sector across Scotland, many businesses, small and large, have taken significant steps in order to ensure that they were complying with the guidance. But unfortunately, not all of them have done so. And that is particularly relevant with respect to the conscientious collection of data on about their customers, so that if there is an outbreak, and we can see the relevance of this in Aberdeen City, then our test and protect system has the data it needs in order to trace contacts who may have been in a particular venue at a particular time, and they may be considered as close contacts. So from Friday, the 14th of August, we will move into statutory guidance for indoor hospitality, the requirement to collect contact details for all customers. There's a number of ways by which they can do that, to maintain 1 metre distancing, to ensure that there is no queuing, there is no standing at bars, there is table service, and a range of other important measures that was in guidance but will now move into statutory guidance with a requirement therefore to comply. And the detail of that will be set out later this week.
Brian Whittle, followed by Stuart McMillan. Mr Whittle.
Thank you, Deputy Presiding Officer. I refer to the report impact restarting elective surgery, in which it details that in the month of March the number of COVID cases in elective hip and knee replacement patients was just 3 cases in 634 operations. Given that the waiting list for those waiting longer than 12 weeks has risen from 10,000 to now over 20,000, and the lack of appropriate treatment leads to significant deterioration in quality of life, can I ask the Cabinet Secretary if she agrees with the report's conclusions that boards should be encouraged to allow redeployed staff to return to their normal roles and support a significant reopening of elective services?
Cabinet Secretary.
So I agree with Mr Whittle in as much as this is a very serious issue, and I am very conscious of the impact on individuals in waiting for what can be life-changing elective procedures. The boards, as I'm sure he knows, all our NHS boards were asked to provide remobilisation plans that would take us through to the end of March next year. Those plans have now been received and are being considered by my officials. The Remobilisation, Recovery and Redesign Group of key stakeholders, there are 32 individuals who are part of that group that I chair, will consider these plans, and part of that will be looking at a number of remaining demands on our health service, the requirement to ensure that we retain sufficient capacity to cope with any upsurge in the number of COVID-19 cases, bearing in mind that the virus self-evidently remains with us and the risk of transmission and hospitalisation remains acute. And we see that elsewhere as we look around Europe and elsewhere in the world. A support system for the Test and Protect service, which is critical to our aim of keeping the virus level as low as possible, and at the same time beginning to restart critical services in our NHS. And those critical services, of course, include elective surgery. And that is one of the reasons why we have retained the NHS Louisa Jordan to be able to assist us in doing that. As those board plans are finalised and as we reach a view on how we will be able to remobilise whilst also allowing the NHS to recover and meet those other demands, then I have already made a commitment to come back to this chamber with the support of the recovery group to set out for members across the chamber, but more importantly for patients and the wider public, the plans that we have in place to take us through towards the end of the current financial year.
Stuart McMillan, followed by James Kelly.
Thank you, Presiding Officer. I'd like to put on record my thanks to the Cabinet Secretary for Health for all the actions of the public authorities in dealing with the cluster in Port Glasgow. But can the Cabinet Secretary make me aware of any lessons that have been learned in dealing with this cluster, which can then be utilised to help across the country any other clusters that will take place?
Cabinet Secretary.
So I'm very pleased to say that in terms of the Port Glasgow cluster that members will recall involved a local pharmacy and another local business. There have been no further cases with respect to that cluster since Saturday, and at this point the incident management team has agreed that it can stand down. In other words, it believes and has the data before it to tell it this, that it has reached the end of the transmission chain, so they have successfully contained that particular outbreak of COVID-19. There are always lessons to be learned. We learned lessons from our very first outbreak and use of Test and Protect in Dumfries and Galloway. But the important part for us is that the local incident management team can make decisions backed by the national support that we give in the system of Test and Protect that makes sense for the particular incidents that they are looking at. And as I'm sure Mr McMillan knows, the outbreak in Port Glasgow is significantly different, for example, in a number of important respects than the one that we are currently dealing with in Aberdeen City. So those lessons are learned. The IMTs talk with each other and provide us as Scottish Government with any additional support that they believe we should be offering them, and we are taking all of that very seriously indeed.
James Kelly, followed by Maureen Watt.
Thank you, Deputy Presiding Officer. A question to the Cabinet Secretary for Justice. Earlier in the pandemic, the Scottish Human Rights Commission raised concerns about prison service regulations that were introduced and the restrictions placed on prisoners bathing and exercise. Such limitations could have a negative impact on prisoners' mental health. So can I ask the Cabinet Secretary what action has been taken to ease these restrictions and make the priority of prisoners' well-being greater up the prison service agenda?
Cabinet Secretary Hamza Yousaf.
I know he has raised this issue before with me, and to give him some reassurance, I've met, or had discussions, I should say, with the Scottish Human Rights Commission, as well as a number of other human rights stakeholders who've got an interest in our prisons. And what I would say to James Kelly is the best thing we can do for those in our care in our prisons is to try to ease the regime as best as we can in line with public health guidance, and that has happened over the past few weeks and months. Importantly, steps that have been taken to introduce virtual visits, to introduce mobile phones, to allow greater access to leisure and later this month to educational opportunities, and I think most importantly to allow the resumption of physical visits. We know what a great impact that is going to have in relation to the morale and I would hope to the mental health and well-being of those in our care in our prisons. And the regulations that we brought forward that would only be used in extremis, I'm pleased to say and reassure James Kelly that that is still the case, that they will only ever be used in extreme cases and will not be the norm moving forward.
Maureen Watt, followed by Alison Johnson.
Thank you, Presiding Officer. Can I ask the Cabinet Secretary for Health what additional measures are being put in place to ensure health boards like NHS Grampian are equipped to deal with the increased pressures on services during the winter period? Cabinet Secretary.
So I'm grateful to Ms Watt for the question. As I said in answer to a previous question, all our health boards have been asked to provide for us their remobilisation plans that will take them through to the end of March next year. We've already gone through with them the first quarter in terms of financial outturns and what additional resources they need given the spend that they have made in terms of responding to COVID-19 so far. The mobilisation plans that come in will include all those areas that I've discussed. Their plans to maintain capacity to deal with any increase in COVID cases, the support that they are offering to test and protect, their winter planning in particular around the increase in the seasonal flu programme that we've announced, a significant increase that will see us, I hope, vaccinate over 2.25 million people in Scotland by extending the eligibility of that. And of course, our health boards, our entire health service across primary care, dentistry, optometry and our community pharmacies most particularly will all have a role to play in delivering on that programme. And in addition, those mobilisation plans will alert us from the boards to any additional resource that they require in order to ensure that they can deliver on the priorities that we agree with them. And we will agree those priorities through discussion with that recovery group that I spoke about earlier, which for members' interest involves the BMA, the Royal Colleges, the RCN, our unions from staff side, as well as other key stakeholders, including Scottish Care and the Alliance for Health and Social Care.
Alison Johnson, followed by Ruth Maguire.
Thank you. Yesterday in a BBC Radio Scotland interview, a journalist asked the National Clinical Director why no routine testing in schools in Scotland, and Professor Leach responded, because routine testing doesn't work, it doesn't help us. Does the Cabinet Secretary for Health share this view, and what assurance can the Cabinet Secretary give teachers that they will be safe in our classrooms in the absence of routine testing? Cabinet Secretary.
So there have been a number of discussions led by the Deputy First Minister and obviously with input from myself but also from our clinical advisors on the safe restarting of schools. Part of that, from my perspective, focused on the whole issue of testing and surveillance. And there is now, I believe, agreement with the unions concerned for what they describe as the triple lock of testing, which is obviously test and protect, and the local incident management teams and health protection teams paying particular attention to what is going on in schools, the involvement in schools in our surveillance work, which gives us important information about the level of the virus in communities across Scotland as well as across Scotland as a whole. And in addition, we have made clear that individual teachers can access through the employer portal testing whether or not they are symptomatic. Obviously, if people are symptomatic, then of course they access testing, but asymptomatic teachers in a comparable way as we have introduced for members of Police Scotland will be able to access a fast route through the employer portal to testing. So we have the triple lock and we also now have this route, all of which is designed to ensure that we are keeping a very close eye on whether or not there is any virus prevalence in and around our schools, so we can act quickly through Test and Protect in order to contain that.
Ruth Maguire, followed by Liam MacArthur.
Presiding Officer, can I ask the Justice Secretary what the Scottish Government is doing to ensure that members of the public are made aware of the risk from organised criminal groups during this crisis, and importantly how members of the public can report suspicions safely?
Cabinet Secretary.
It's a really important issue raised by Ruth Maguire. It's an issue that the Serious Organised Crime Task Force and I discussed at our last meeting. We know that serious organised crime groups will try to take advantage, particularly of people with vulnerabilities during this pandemic. So we work closely with the National Cyber Security Centre and Police Scotland to provide organisations and, importantly, individuals with advice and guidance on the cyber fraud threat. We also support Police Scotland's initiative, Shut Out Scammers, which is a really positive campaign in order to inform individuals about the possibility of fraud. Of course, members of the public can report any concerns to Police Scotland, and they should, on 101, or indeed if it's an emergency, of course, using 999, but also independently, also to the independent charity Crime Stoppers on 0800 555 111.
Liam MacArthur, followed by John Mason.
Thank you, Deputy Presiding Officer. The Justice Secretary will be aware that around a quarter of Scotland's prison population is on remand, double the number south of the border. He will also have heard the warning from Her Majesty's Inspectorate that the number of people being put on remand is huge and growing. Now, while the pandemic has certainly exacerbated the situation, this is not a new problem. So can the Justice Secretary advise the Chamber what steps he's taking to address the disproportionately high level of remand prisoners in our prison population?
Cabinet Secretary.
Well, can I thank Lee MacArthur for, again, a very important question indeed. Just a couple of caveats before I answer the question. One is that, of course, bail decisions are decisions that are made by the independent courts, but also he is right to mention or allude to the fact that the main reason for the significant increase in the remand population has been the suspension of court business, particularly of jury trials. But he's also correct to say that this was a problem pre-pandemic as well. So just in the interest of brevity, there's effectively three actions that I'm proactively considering. First and foremost, to resume court business. Of course, if I can do that, and we've begun to see the resumption of solemn court business, that will, of course, help with the remand numbers. I'll be making a further announcement about that before my appearance to the Justice Committee next week. Secondly, continued investment in bail supervision. We know that bail supervision has increased by 26% in 18-19. That's not happened by accident, it's happened because we've put funding into that. But I think probably one of the most significant measures, which I'm pleased to be able to give a bit of detail about today, is that I would intend to bring forward regulations to enable electronic monitoring of bail. You'll of course know about the Management of Offenders Act allowing us to use electronic monitoring for that purpose, subject to the agreement of parliamentary authorities. My intention would be to seek agreement to bring forward these regulations in September, at the very latest in October, but I'd hope to bring them forward in September. We'll continue our consultation with a number of groups who would have an interest in electronic monitoring, but I do think if we get electronic monitoring up and running for bail, then it will be a real game changer and allow us to reduce the remand population.
Sorry. John Mason, followed by Lewis MacDonald.
Thank you very much. A sports question. Given that a number of ALIOs seem to be struggling to reopen sports facilities and have financial problems, has the Government had any discussions with either Glasgow City Council or Glasgow Life concerning reopening these kind of facilities, including Crown Point Athletics venue in my constituency?
Cabinet Secretary or Minister, which one is taking this? Cabinet Secretary.
Thank you very much. We are aware of the particular difficulties that are facing those organisations. Discussions are continuing with COSLA on how we can best support those leisure bodies through the local government funding. And that continues so that we can try and ensure that we have, for example, perhaps a tailored lost income scheme for Scottish councils that includes some allowance for ALIOs. So those discussions continue and I hope that we will see a resolution on them soon.
Lewis MacDonald, followed by Rona Mackay.
Thank you very much. The local outbreak in Aberdeen has once again highlighted transmission by people without symptoms, as well as the vital importance of contact tracing. Does the Health Secretary accept that testing all known contacts can help to assess and to contain local outbreaks, even if test results are not accurate in every single case?
Cabinet Secretary.
So it's a very important question that Mr MacDonald has asked. As he knows, we've had many discussions on this, and the evidence on testing of asymptomatic individuals has evolved over time, of course, as we learn more and our scientists and clinicians globally, as well as here in Scotland, learn more about this particular virus. What appears to be growing evidence is that in a pre-symptomatic stage, individuals shed more of the virus. Not as much as when you're symptomatic. Of course, when you're symptomatic, you are coughing and sneezing and so on, so the risk is greater. But there is a risk in terms of those who are pre-symptomatic. And so part of the revise of our testing strategy, which is underway and almost completed, and I hope will be completed soon, is giving active consideration to the testing of contacts through the Test and Protect scheme. There have been instances where we have done that, for example, in our Dumfries and Galloway handling of the outbreak there. Contacts were tested and proved helpful, although, as you say, you can get both false positives and false negatives with those who are asymptomatic. But it is part of the consideration that we have underway in terms of the revise of our testing strategy. And as I say, I hope very much that we'll be able to conclude that and publish that new strategy soon.
Rona Mackay, followed by Liam Kerr.
Thank you, Presiding Officer. My question is for the Cabinet Secretary for Justice. Prior to recess, Lady Doreen announced pilots for the resumption of a small number of solemn criminal trials in Edinburgh and Glasgow based on the use of multiple courtrooms for a single trial to help with physical distancing. And the Cabinet Secretary mentioned that in an earlier question. Can the Cabinet Secretary provide an update on how successful these pilots have been and what progress has been made to clear the inevitable backlog of cases caused by the pandemic?
Cabinet Secretary.
Can I thank Rona Mackay for the question? She's right. We're all very pleased to see the resumption of solemn business. Of course, that is constrained because of the physical capacity of the court estate adhering to physical distancing guidelines. Therefore, although the feedback has been positive, I noticed some really positive comment from both defence but also from prosecutors involved in cases. We're also listening and engaging with victims' organisations to get their feedback as well. So although the feedback has been, on the whole, very, very positive, we're having to think about innovative solutions that we've never thought about before in relation to maximise the amount of trials that can take place. And as I mentioned in a previous answer, I hope to be able to give an announcement on this ahead of my appearance to the Justice Committee next week. But even just getting to the number of trials we had pre-COVID is itself going to be a challenge, let alone more trials than that, which would help us to deal with the backlog. So the backlog, I'm afraid, is a significant issue that we'll continue to need to keep our minds focused on.
Liam Kerr, to be followed by Joan McAlpine.
Thank you, Presiding Officer. Can the Cabinet Secretary for Health tell me what evidence supports the decision that gyms in Scotland remain closed whilst pubs and restaurants can open?
Cabinet Secretary.
So I'm very happy to provide Mr Kerr with the detailed evidence from our clinical advisors. You will, I'm sure, appreciate that as politicians we don't make these decisions without having that evidence before us. It centres primarily around the means by which transmission happens and the circumstances in which that transmission happens. And as I've said at the start of this answer, I'm very happy to provide you with that information and that evidence.
Joan McAlpine, followed by Sarah Boyack.
Thank you. To ask the Cabinet Secretary for Health...
Could you put your microphone? That's it.
Thank you. To ask the Cabinet Secretary for Health what progress has been made in protecting and supporting people with learning disabilities at risk of contracting COVID-19.
Cabinet Secretary.
Every fortnight or thereabouts, I have a detailed meeting with the Care Inspectorate, and we have looked in particular at the situation for in terms of residential care and support for individuals with learning disabilities, and the Care Inspectorate is now taking forward some particular steps in that regard. Of course, in terms of adult residential services in social care, the work that we are undertaking across the piece there applies in those settings. In addition, I've had detailed conversations with Sally Witcher from Inclusion Scotland to make sure that we are covering all the areas in terms of health. Although obviously my colleague Ms MacLeod has other locus in this particular work, as does Ms McKelvey, so that we are taking forward the particular areas of support. We're now looking at how safely and how soon we can open day centre support for individuals, both those who are elderly but also other adults who make significant use and benefit from that day centre support and who have not been able to participate in that for some months. And part of our current work in terms of this whole area of adult social care is looking at how the steps we need to take to be able to safely open those centres so that people can again benefit from their use across the country.
Sarah Boyack, followed by James Dornan.
Thank you, Presiding Officer. Can I follow up the previous questions to the Cabinet Secretary for Health and Sport about the scientific guidance that allows pubs to open but not leisure facilities, and ask what types of leisure facilities are seen as high risk and how that is evaluated? I've had a lot of constituents raising this issue with me. Don't we need to see action to enable people to get vital physical and mental health benefits from access to leisure facilities, especially with the growing concerns there are now about their financial viability, with 18 leisure centres and 8 swimming pools now at risk of permanent closure? Thank you, Presiding Officer.
It's just I've got an awful lot of people. I want to try and get everybody in. Cabinet Secretary.
Absolutely right, and I wouldn't disagree with her about the importance of many facilities in terms of physical and mental well-being of all adults and in particular of children. The two particular areas that we have not yet reached a decision on in terms of a date for opening, but they do have indicative dates, are both gyms and swimming pools. And I'm very conscious in terms of swimming pools that they also offer particular therapeutic opportunities for people with particular health conditions. And that is a matter I take very seriously. Again, as I said to Mr Kerr, I'm very happy to provide you with the evidence that we looked at in determining that they would not open at this point, but we continue to keep those under review. We have taken steps in terms of outdoor activities for children and young adults in particular, and I'm currently looking at what more we can do in terms of adults and outdoor organised sport, whether or not we can proceed quickly in those areas.
James Dornan, followed by Dean Lockhart.
For the Cabinet Secretary for Transport. Can the Cabinet Secretary outline how the Scotland Cycle Repair Scheme will help maintain the positive increase in the numbers of people we've seen cycling across the country, while helping to manage demand on public transport during the COVID-19 pandemic?
Cabinet Secretary.
Presiding Officer, it's been very encouraging to see the number of people who are cycling on a daily basis now during the course of the pandemic, and we want to try and help to maintain that and encourage that going forward, particularly as the restrictions start to ease and the restrictions which we have in public transport with limited capacity due to physical distancing requirements. And therefore, the cycle repair scheme is an opportunity for those who may have a cycle, a trike or manual wheelchair that they want to make greater use of, that they want to have repaired, that they can get £50 towards the repair costs of their bike or trike, and that provides part of the £1.5 million that we're making available for this, which allows some 30,000 people to participate in the programme with the shops that are operating the scheme right across the country.
Dean Lockhart, followed by Kenneth Gibson.
Thank you, Presiding Officer. Question for the Cabinet Secretary for Transport. Before the outbreak of COVID, the 2 CalMac ferries being built at Ferguson Marine were more than £100 million over budget and more than 3 years overdue. Can the Cabinet Secretary provide an update on the latest timetable for completion and the latest budget overspend for the 2 vessels?
Cabinet Secretary.
Presiding Officer, as the member would recognise, during the course of the pandemic, construction work on sites such as the Ferguson's Yard have had to come to a halt. However, as the construction guidance has been introduced that allows a return to work, some of the construction work has started again. What I can say to the member is that there's a reassessment of the existing work programme being undertaken, which includes looking at the costs associated with that. But as is the case with many construction projects, as they have lost time during the course of the pandemic due to physical distancing and the need to have restricted work arrangements.
Kenneth Gibson, followed by Alec Rowley.
Thank you, Presiding Officer. Can the Cabinet Secretary for Health confirm whether or not the goal of the Scottish Government is the complete eradication of the COVID-19 virus from Scotland, and if so, whether it believes that can be achieved concurrently with life returning to the normality we enjoyed before the pandemic struck, or do ministers envisage periodic lockdowns, following outbreaks and health restrictions on everyday social activities becoming the new norm?
Cabinet Secretary.
So our goal as a Scottish Government is the elimination of COVID-19 in Scotland. We cannot pursue a goal of eradication, which means that it doesn't exist, not least because the opportunities for importing the virus into Scotland are not opportunities that we have complete powers over to control. So the aim of the Government is elimination, that is to drive down the virus to the lowest possible level that we can manage. We cannot expect to be able to do that and release some of the lockdown measures, and as we have done, and not see outbreaks of the virus, because the virus is still with us and it still remains in our communities. And we see that in the outbreaks that we have seen in Dumfries and Galloway, in Port Glasgow, in Lanarkshire, and now in the city of Aberdeen. That is why 2 things are absolutely critical. One is that as individuals we take personal responsibility for our own behaviours that will control and eliminate the transmission of the virus. So that's the point of the facts guidance about face coverings, about cleaning our hands, about maintaining 2 metres physical distancing, about if we have any symptoms at all, not waiting to see if they maybe get a bit better, but booking a test and isolating ourselves away from others, including others in our own household. And the second part of how we will pursue this so that we can return life in Scotland to greater levels of normality is through Test and Protect and the Test and Protect system of our National Health Service. In time, we hope that there will be a vaccination for COVID-19. We are part of the 4-nation work on that, and we are ready to have a vaccination programme that would deliver a vaccine to people in Scotland. But at this point, we don't have such a thing. So our pursuit of an elimination strategy has to combine those 2 key elements I talked about, which is constantly reinforcing the personal responsibility of each of us as the first line of defence against transmission of the virus, and supporting and in resourcing Test and Protect as our second line.
Alec Rowley, followed by Sandra White.
Thank you, Presiding Officer. Can I ask the Justice Secretary if there has been any assessment carried out of the impact of COVID on policing, on resources, on the ability to actually do their job? And given that we have new rules coming out this week, I think, for pubs and other facilities such as that, does the police have the resources to be able to police these areas?
Cabinet Secretary.
I can thank Alex Rowley for, again, an important question. I speak to Police Scotland, usually as Chief Constable or one of his DCCs at least a couple of times a week. And fair to say that throughout the pandemic, we have worked with them hand in glove in relation to the regulations being brought forward and indeed the guidance as well. There's no doubt at all that Police Scotland have very admirably officers and staff being at the front line, keeping us safe, where necessary, enforcing the measures that need to be taken in regulation, but taking a very common sense approach to enforcement throughout the pandemic. What I'd say in direct answer to Alex Riley's question is there's simply no doubt, and it'd be foolish to suggest otherwise, that there hasn't been a significant financial impact right across our public services due to the pandemic. So I'm keeping in very close contact with Police Scotland and the SPA. I spoke to the interim chair, David Crichton, just the end of last week to discuss this very issue, and we're certainly keeping in close contact with them. We'll obviously look to see what assistance we can provide in the forthcoming spending review discussions that will take place. But clearly, it's fair to say that there is an impact, not just on COVID, not just because of COVID. We are getting to business as usual in terms of normal crime rates. We have Brexit and a no-deal Brexit threat imminent as well, and the implications of that, plus, of course, a rearranged COP26, which will also have significant pressures on policing as well. So we're having continued discussions with Police Scotland on those budgetary pressures.
Sandra White, followed by Mark MacDonald.
Cabinet Secretary for Justice, please. The Cabinet Secretary will be aware of the closure of the Forensic Toxicology Lab at Glasgow University excuse me, due to COVID-19, and also the drug deaths in Glasgow, which have increased during COVID-19. So can I therefore ask the Cabinet Secretary to provide an update on what the current status is with outstanding cases and new cases coming through the system? And can you tell us what the future holds for the Forensic Lab services, and whether or not COPs will revisit the decision to withdraw from utilising their services?
Cabinet Secretary.
Can I say, Sandra White, that I'll ask Lord Advocate to write to her with greater detail, because obviously Lord Advocate has remit over this. She'll know that it's not for government to intervene in his independent functions, but nonetheless, this is, of course, an extremely important issue. Indeed, Sandra White will be aware of the fact that COVID did have an impact on the lab, and therefore work did have to pause. I know that work has restarted. I know also that it's been publicly announced that there's been a further extension to the contract with GU until Glasgow University until the end of January 2021, which will hopefully give some reassurance to the staff there. I can't go into detail about the other provider and the commercial sensitivities in and around that, but I will ask that Lord Advocate writes directly to Sandra White to give her detail about the additional resources that have been committed to address that backlog, and undoubtedly, which is undoubtedly causing suffering to many loved ones as they wait for the results of those of the toxicology reports.
Mark MacDonald, followed by Maurice Corrie.
Thank you, Presiding Officer. I suspect this will be for the Cabinet Secretary for Justice. In light of the question from Gillian Martin around individual establishments in the City of Aberdeen, with the regulations the Scottish Government are bringing forward, will there be additional powers being given to licensing boards, or do they already have the powers to take enforcement action against the licence holders of any establishments which are seen to be contravening the regulations and also acting inappropriately? And would the Scottish Government also send a very clear message about the inappropriateness of individuals looking to undertake pub crawls during this period, and what steps can be taken to prevent that from being done through multiple establishments?
Cabinet Secretary. Well, a set of very good questions from Mark MacDonald. Indeed, what I would say is that as current rules exist for licensing, and many members will be aware of this, of course, a licence holder's not just ability, but the licence holder's history of obeying the rules is something that can be taken into account when it looks to reapplying for that said licence. Now, I've asked the Minister for Community Safety, who leads on licensing matters, to take a look at this issue afresh in relation to as a result of the current context that we find ourselves in. So if there's more that we can do in terms of discouraging bad behaviour from licence holders, then we will look to absolutely do that. And he makes a good point around pub calls and those people who go to multiple licensed premises during a day. We have sent, the First Minister has sent a strong message before in her daily briefings that, of course, the more people look to do that, then they are putting themselves and their loved ones at risk, because we know of the dangers of the transmission, particularly in an indoor environment. But in relation to the first part of his question, whatever more we can do within the powers that we have in with licensing, then we will certainly seek to do that.
Maurice Corrie, followed by Alistair Allen.
Thank you, Deputy Presiding Officer. There's a question for the Cabinet Secretary for Transport. Last week's A83 closure at the Rest and Be Thankful in my region was the latest in a long line of closures over many years. This route is vital for my constituents and businesses who rely on this every day of the week. They now require a long-lasting permanent solution to the problem. Can the Cabinet Secretary explain how the Scottish Government will fix this long-running problem once and for all, and not just implementing another review and digging more ditches at the roadside?
Now, it's not quite COVID-related, but I think the Cabinet Secretary is going to speak and answer it.
More than happy to respond to the point raised by the member, and I recognise the very significant concern there will be for those who have experienced the disruption and difficulties caused by the most recent landslide that's taken place in the Rest and Be Thankful in the course of the last week. A very significant landslide of 6,000 tonnes, which come onto both the main carriageway and down onto the old military road, which has caused significant damage to the A83 at the Rest and Be Thankful itself. I'm very grateful to the engineers and those who have supported them over the course of the last week in order to get the OMR open. What I can say to the member is that I recognise, and as I said out at the last task force meeting, I don't know if the member was there, I'm not sure if he was, we are already looking at 7 different options as an alternative route for the Rest and Be Thankful. That's part of the STPR2 process. As I also set out at the task force meeting, I have already accelerated that process in order to ensure that they are the first elements of the STPR2 process that's considered by ministers in order to look at what the most appropriate mitigation measure would be in terms of an alternative route for the Rest and Be Thankful. So I can assure the member that we'll continue to focus our work on looking at what that alternative route should actually be in order to make sure that we have a long-term solution to what has been a long-standing problem with the Rest and Be Thankful.
Alistair Allen, followed by Neil Findlay.
As the Transport Secretary will be aware, my constituents rely on Lifeline ferry services. Will he acknowledge that the relaxation of COVID-related restrictions on bookings, while welcome in themselves, have brought us to the difficult situation where many sailings are now beginning to show as booked out well in advance?
Cabinet Secretary.
Presiding Officer, Alistair Allen raises an important issue which I know will be a matter of concern for some of his constituents. He'll be aware of the many competing demands which we face across the ferry network in helping to support local residents, being able to travel around key workers, essential trade and also tourism. And given the physical distancing that has to be maintained on the ferry network, which has now moved from 2 metres to 1 metre where it can, capacity has been increased, but also to try and address the concerns of local residents. Some 20% of tickets are held back on any given sailing in order to be available on a turn-up-and-go basis, to try and accommodate the needs of local residents and essential workers where possible. What I can assure the member is that CalMac are continuing to look at whether there are further measures that they can take forward in order to increase capacity. So, for example, they continue to be engaged with the MCA to look at whether there are relaxations around some of the regulations that apply to car decks, which have been achieved in some crossings. And I can assure the member if there are further measures that can be undertaken to increase capacity yet further, that CalMac will look at those measures. But if the member has a very specific concern regarding his own constituents' experience and a view as to how that could be resolved, I'd be more than happy to respond to the member directly on that.
Neil Findlay, followed by Alec Cole-Hamilton.
To the Cabinet Secretary for Health. On the BBC disclosure programme, the Chief Executive of Scottish Care said of the Scottish Government advice to care homes that residents who are showing symptoms of COVID should not normally be admitted to hospital, unacceptable, inhumane and a derogation of the duty to protect life. Given that the Cabinet Secretary and the First Minister refused to take part in the programme, can I ask the Cabinet Secretary, who is accountable for a policy that was a derogation of the duty to protect life?
Cabinet Secretary. There we are.
Yes, let me be clear about a couple of things. I did not refuse to take part in that programme. I was unwell at that point. And I regret that I couldn't take part in that programme because there would be a number of issues that I would have sought to give a different perspective on. The Chief Executive of Scottish Care has been heavily involved in all the work that we have done, all the guidance that we have issued, and has played a very constructive role with us in ensuring that we understand some of the key issues in and around care homes, and has challenged us and argued with us on many occasions, asking for more to be done. And I hope that we have responded positively in all of those. We have had this discussion before. It was not our clinical guidance that residents in care homes, where they're required to be admitted to hospital, if that was the clinical opinion, they should be admitted to hospital. And that has always been the position. It is not for a politician to take clinical views like that. It is entirely for the local clinician to make their decision based on their professional judgment about where is the best place for an individual to receive the care that they determine as their clinician they require. That has always been our position as a government. That remains my position as the Health Secretary. And for as long as I am the Health Secretary, that will continue to remain my position. Politicians do not make these decisions. Experienced clinicians do.
Alec Cole-Hamilton, followed by Angus MacDonald. Mr Cole-Hamilton.
Thank you very much, Presiding Officer. My question is to the Cabinet Secretary for Transport. Edinburgh Airport in my constituency have signalled that they may shed up to a third of the 750 jobs in my constituency. Will the Cabinet Secretary undertake to meet with the aviation sector to explore testing as an alternative to quarantine? And will he also rule out the possibility of an English quarantine order on all English passengers, which is currently harming our important domestic market?
Cabinet Secretary.
Presiding Officer, I recognise the concern that the member has raised about the potential job losses at Edinburgh Airport. And obviously our concern is with those workers who may be affected by the redundancy programme, and we stand ready through our services, through PACE, who are already in place to provide support and advice to those workers who have been adversely affected today. What I can say to the member is that we've had extensive engagement with the Edinburgh Airport. I've had a number of discussions with the Chief Executive of Edinburgh Airport, as has the First Minister. We will continue to engage with them going forward to look at what measures we can play in helping to support them. The member may recognise is that the Scottish Government has provided, as part of its £2.3 billion support package, business rates relief to our airports, airlines and those air support agencies that are based at our airports, including at Edinburgh Airport, something which is not available to airports in England and Wales. We will continue to engage with them specifically around how we can recover some of the routes which have been lost into Scottish airports as part of our route recovery strategy, so we can identify the key areas where there are potential routes that could be re-established, which are key to our business and inward tourism sector. So I can absolutely assure the member we will continue to engage with the sector to provide what support we can. However, the member will recognise that the global impact of the pandemic on the aviation sector has been very significant and will remain significant for an extended period of time, which is why we've called upon the UK Government to extend the job support scheme for an extended period of time to support the aviation sector through what is a difficult period and will continue to be a difficult period for a considerable period of time. I've made representation to the UK Government in that matter, and we will continue to press them on addressing this issue.
And Angus MacDonald.
Thank you, Presiding Officer. The Cabinet Secretary for Transport will be aware that one of the major casualties from COVID-19 is the bus manufacturing industry due to a significant slump in demand for new buses. He'll also be well aware of the restructuring plans announced by Alexander Dennis in his Falkirk West constituency. Given that a large number of my constituents work at ADL, can the Cabinet Secretary advise the Chamber what progress has been made regarding exploring ways of supporting bus operators to overcome the higher upfront capital costs of new zero-emission buses as part of the economic recovery from the COVID-19 pandemic, which would clearly have the added bonus of simultaneously accelerating decarbonisation of the bus sector?
You make the best of that, Mr MacDonald. You've waited a long time. Cabinet Secretary.
Presiding Officer, the member raises a very important issue about the ongoing impact that the downturn in the use of buses as a form of public transport is having on the wider bus manufacturing industry. And I'm acutely aware of the potential challenges this creates for manufacturers such as Alexander Dennis and their operation here in Scotland, based in my own constituency in Falkirk West. I've had extensive engagement directly with the senior management team at ADL and also with the trade unions around the potential risk of job losses at ADL. We have a very strong track record in supporting bus manufacturing in Scotland. Over recent years, we've provided almost £17 million in the Scottish Green Bus Fund, which has helped to support almost 500 new low-emission buses to be provided across the network. We've also been working extensively with Alexander Dennis to look at what further measures could be implemented to try to help to support recovery in the sector. And we've been taking forward at pace a very significant piece of work with the Scottish National Investment Bank to look at the provision of a leasing model for bus operators rather than to buy buses, to lease those buses. So far, the feedback from the bus sector has been positive, and we're trying to move that whole process forward as quickly as we can to help to support not only the greening of the bus fleet, but also the bus manufacturing sector. In addition to that, we also want to make sure that ADL remains at the cutting edge of new technology within low-carbon public transport. And Scottish Enterprise have made available a grant of some £10 million over the next 2 years to support them in research and development. To date, ADL have had access to around £7 million of that in the course of this financial year, and they'll provide the remaining part of that grant as they take forward the research and development work. So I can assure the member that we are continuing to work with the company as best we can to help to support the business going forward and to encourage bus operators to start placing orders for new buses, and particularly ultra-low emission vehicles, which Alexander Dennis has specialised in. And I can assure the member we'll continue to press forward with the work that we are taking forward to try to help to support the sector as it recovers.
Thank you very much. That concludes questions. Can I thank the Cabinet Secretaries and members as we managed to get through all questions. There will be a short pause till we move on to the next item of business.
Thank you, colleagues. The next item of business is consideration of Business Motion 22405 in the name of Graham Day on behalf of the Parliamentary Bureau, setting out revisions to Thursday's business. Could I ask any member who wishes to speak against the motion to press their request to speak button now, and could I call on Liz Smith to move the motion? Thank you very much. And no member has asked to speak against the motion. The question, therefore, is that motion 22405 is agreed. Are we all agreed? Yes. We are all agreed. Thank you. Now, there are actually no further questions to be put as a result of today's business, so that concludes decision time. I close this meeting.